Which of the following is most likely to occur if the blood temperature is excessively lowered during cardiopulmonary bypass? A. Decreased metabolic rate and organ protection. B. Increased risk of bleeding due to coagulopathy. C. Increased risk of clot formation. D. Hyperglycemia and acidosis. Answer: A. Decreased metabolic rate and organ protection. Explanation: lowering the blood temperature during CPB is a common strategy for reducing metabolic demand, which helps to protect organs, especially the brain and heart, during periods of ischemia. This technique is known as hypothermic circulatory arrest. While hypothermia can increase the risk of bleeding due to coagulation changes, option B, its primary role is to decrease metabolic activity and offer organ protection, making option A the best answer. Which of the following parameters is most commonly used to assess the adequacy of perfusion during cardiopulmonary bypass? A. End-tidal carbon dioxide, ATCO2. B. Central venous pressure, CVP. C. Urine output. D. Blood glucose levels. Answer: A. End-tidal carbon dioxide, ATCO2. Explanation: ATCO2 is commonly used to assess the adequacy of tissue perfusion during CPB. Elevated ATCO2 can indicate poor tissue perfusion, while a low ATCO2 can suggest hyperventilation or inadequate ventilation. Central venous pressure, urine output, and blood glucose levels are also monitored, but ATCO2 provides a direct reflection of the balance between oxygen delivery and consumption. What is the primary function of the venous reservoir during cardiopulmonary bypass? A. To filter impurities from the blood. B. To collect and store blood returning from the body. C. To regulate the blood pressure. D. To increase the oxygenation of blood. Answer: B. To collect and store blood returning from the body. Explanation: the venous reservoir serves as a collection chamber for blood returning from the body during CPB. It ensures that blood is continuously available for the oxygenator and pumps. This helps maintain consistent blood flow and volume throughout the bypass. It does not filter impurities, which is the role of other filters in the CPB system, regulate blood pressure, or directly increase oxygenation. Which of the following statements about hemodilution during cardiopulmonary bypass is true? A. It increases the viscosity of blood, improving oxygen delivery. B. It decreases blood volume, reducing the need for blood transfusions. C. It lowers hematocrit, which can reduce oxygen carrying capacity. D. It prevents clotting during bypass. Answer: C. It lowers hematocrit, which can reduce oxygen carrying capacity. Explanation: hemodilution during CPB involves diluting the blood by adding fluids such as crystalloid or colloid solutions. This reduces the hematocrit, the proportion of red blood cells in the blood, which in turn can decrease the oxygen carrying capacity. However, the decreased viscosity can be beneficial in reducing the workload on the heart and improving blood flow through the circuit. While hemodilution reduces the risk of clotting, by reducing the concentration of clotting factors, its main concern is the lowered oxygen carrying capacity. Which of the following is typically used to monitor the oxygenator during cardiopulmonary bypass? A. Pulmonary artery catheter. B. Oxygenator pressure gauge. C. Arterial blood gas analysis. D. Echocardiogram. Answer: B. Oxygenator pressure gauge. Explanation: the oxygenator pressure gauge monitors the pressure within the oxygenator to detect any potential issues such as clotting or decreased flow, which may indicate malfunction. While arterial blood gas analysis, option C, is critical for assessing oxygenation, the oxygenator pressure gauge provides real-time feedback on the function of the oxygenator. Pulmonary artery catheters and echocardiograms are used for different purposes and are not typically used to monitor the oxygenator itself. Which of the following is a primary purpose of anticoagulation during cardiopulmonary bypass? A. To reduce the viscosity of the blood for easier circulation. B. To prevent clot formation in the bypass circuit. C. To prevent arrhythmias during surgery. D. To decrease the patient's blood pressure during the procedure. Answer: B. To prevent clot formation in the bypass circuit. Explanation: Anticoagulation is essential during cardiopulmonary bypass to prevent clot formation in the bypass circuit, which could lead to embolism or occlusion of the circuit. Heparin is typically used for this purpose. While anticoagulation can have secondary effects on blood viscosity and patient blood pressure, its primary goal is to prevent clotting. During cardiopulmonary bypass, what effect does hypothermia have on the body? A. It increases metabolic demand, protecting organs from ischemia. B. It reduces the body's oxygen consumption and metabolic rate, offering organ protection. C. It increases the heart rate and blood pressure, improving circulation. D. It decreases clotting factors, increasing the risk of bleeding. Answer: B. It reduces the body's oxygen consumption and metabolic rate, offering organ protection. Explanation: Hypothermia is commonly used during CPB to reduce metabolic demand and protect organs, especially the brain and heart, during periods of ischemia. Lowering the body temperature slows down cellular processes, reducing oxygen consumption and helping to preserve organ function while the heart is not pumping. Which of the following is an essential step when transitioning from cardiopulmonary bypass back to normal heart function, weaning phase? A. Decreasing the heart rate and systemic vascular resistance. B. Gradually reintroducing cardiac function by reducing bypass flow while supporting hemodynamics. C. Lowering the temperature rapidly to promote myocardial function. D. Increasing the use of vasopressors to elevate blood pressure. Answer: B. Gradually reintroducing cardiac function by reducing bypass flow while supporting hemodynamics. Explanation: The weaning phase involves gradually decreasing the support provided by the CPB machine, allowing the heart to resume its pumping function. This is done by reducing the bypass flow and carefully adjusting hemodynamic parameters to avoid cardiovascular instability. The goal is to allow the heart to take over the circulation without overwhelming it. Which of the following best describes the role of the cardiopulmonary bypass pump? A. It oxygenates the blood while bypassing the heart and lungs. B. It filters waste products from the blood during surgery. C. It increases blood pressure during surgery. D. It is used to infuse medication directly into the bloodstream. Answer: A. It oxygenates the blood while bypassing the heart and lungs. Explanation: The CPB pump serves as the heart during surgery, circulating the blood and oxygenating it in an external oxygenator while bypassing the heart and lungs. This allows surgeons to perform surgery on a still heart. The pump does not filter waste, the oxygenator does this to some extent, or directly infuse medications. Which of the following monitoring devices is essential to assess the adequacy of cerebral perfusion during cardiopulmonary bypass? A. Invasive blood pressure monitor. B. Cerebral oximetry. C. Arterial blood gas analyzer. D. Pulse oximeter. Answer: B. Cerebral oximetry. Explanation: Cerebral oximetry uses near-infrared spectroscopy, NIRS, to measure the oxygen saturation of hemoglobin in the brain, providing real-time data about cerebral oxygenation during CPB. This is crucial for ensuring that the brain receives adequate oxygenation and perfusion during the procedure. Other devices like blood pressure monitors or pulse oximeters can help assess general circulation but are not specific to brain perfusion.